I'm honored to introduce Carol Pandak. She is the director of Rotary International's PolioPlus program. She directs all aspects of Rotary's polio eradication program, including administration, advocacy, communications and financial oversight, fundraising support, grant management, and volunteer engagement. She is the liaison to Rotary International's PolioPlus committee, the volunteer committee that provides polio guidance to the PolioPlus program. She works closely with the partners of the Global Polio Eradication Initiative, the World Health, including the World Health Organization, UNICEF, U.S. Center for Disease Control and Prevention, the Bill and Melinda Gates Foundation, and Gavi, the Vaccine Alliance. She serves on multiple cross-agency committees and management groups that provide strategic and operational guidance to the global effort. Carol, we're honored to have you here tonight. Thank you so much.
Thank you so much, Cindy, for the invitation. Heinz, Marilyn, Devin, Sue, great to be with you. And I recognize many of the names that are in the audience this evening. I've spent some time in the Utah area working with Rotarians, attending events, doing some work with Latter-day Saints. So it's good to be with everyone this evening. I'm also a Rotarian. I didn't have that in my bio, so I've been a Rotarian for many years. I am a past president of the Schaumburg AM Rotary Club in the suburban area here in Chicago, and I'm currently a member of the Evanston Lighthouse Rotary Club. And I am coming to you this evening from my living room in downtown Chicago, where I live and look over the concrete canyon, maybe somewhat different than what you're looking at there in your communities. I do have a brief PowerPoint this evening, which I'd like to show, about 13 slides, and I'd be happy to answer questions and have further discussion. So let me pull that presentation up. So what I'm going to do this evening is to provide an sort of an overview of the PolioPlus program, the Global Polio Eradication Initiative, within the context of COVID-19, because COVID-19 has had, as it has on our lives, a significant impact on global polio eradication efforts. Now, just as a reminder, and this is was just said in the introduction, Rotary is a member of the Global Polio Eradication Initiative. We are actually a spearheading partner of the Global Polio Eradication Initiative that was founded in 1988, 3 years after Rotary launched its PolioPlus program. The spearheading partners are Rotary, the World Health Organization, UNICEF, and the U.S. Centers for Disease Control and Prevention. The Bill and Melinda Gates Foundation joined the Global Polio Eradication Initiative in 2007 after making their first $100 million commitment to Rotary. And then Gavi, the Vaccine Alliance, joined the partnership at the end of December 2019. So we're going to talk about the infrastructure of the Global Polio Eradication Initiative this evening. And I think of the infrastructure really of having two parts. One part are the frontline healthcare workers that are going door to door, house to house, train to train, market to market, to find every child under the age of 5 to immunize them against polio. Because the goal of polio eradication is to find every child under the age of 5 and immunize them. This takes hundreds of thousands of frontline healthcare workers, mostly women, that are out there immunizing children. And this happens over a 3 to 5 day period where in a country will try to immunize all of their children. In between the vaccination campaigns, there are community mobilizers that are, again, usually women who live in communities, are trusted members of the communities, who talk to families, especially mothers, about the benefits of vaccination, polio and others, but also educating them on health and well-being overall. And then there's technical expertise that's brought to the campaigns, the polio immunization campaigns, by the tens of thousands of medical officers. So that's one side of the polio infrastructure. Now the other side of the polio infrastructure is the disease surveillance activities that are taking place so that we know where there's any possible case of polio. And this consists of 146 specialized polio laboratories around the world. And this requires hundreds of thousands, again, surveillance medical officers that are going out into communities, investigating possible cases of polio, taking a stool sample from that child and delivering that to a laboratory. And it's to one of these laboratories that you see on this map. This also requires thousands of laboratory technicians to then test the samples once they're found. This way we can really identify where polio is circulating. But not only are these lab technicians testing stool specimens, but we're also now conducting what's called environmental surveillance, where we're testing sewage water for polio isolates, virus isolates, because the polio virus can live in sewage water for a period of time. So you've got the frontline healthcare workers vaccinating children in communities, supported by the Global Polio Laboratory Network and surveillance officers to help us detect any possible case of polio. So this infrastructure has resulted in great progress in polio eradication. So in 1988, there were 125 countries endemic for the wild polio virus, 350,000 cases every year. And now we're just down to really 2 countries, Afghanistan and Pakistan, that are continuing to report cases of wild polio virus. If you can see on the map, Nigeria in Africa is a little bit lighter color. That's because they have not been certified polio free yet, but have not had a case of wild polio virus for more than 3 years. So far this year, the surveillance system has detected 54 cases of polio, 43 of those in Pakistan and 11 of those in Afghanistan. So this is a view of COVID today, or COVID about a week ago, 2 weeks ago. And so you can see COVID sort of looks like polio did at the height of the polio epidemics in the world. So you see a lot of red dots, which is sort of what we saw with polio. So we have this huge infrastructure for polio eradication. So it was agreed that the polio infrastructure would help support the COVID response, because the Global Polio Eradication Initiative has one of the largest global health footprints around the world. So what are these polio workers actually doing? Well, they're working to coordinate outbreak response. If there is a detected case of COVID, they go into the community and do contact tracing, education on hand washing, hygiene, how to protect yourself against COVID, investigating cases, and training healthcare workers. So it's very, very similar to the type of work that we're doing in polio, using that infrastructure of frontline healthcare workers protected with protective equipment like masks and gloves, et cetera, but also the surveillance officers that are looking for cases of both polio and COVID. And these are just a few of the concrete examples of how the infrastructure is supporting the COVID response. And I think about this as really representing the plus in PolioPlus. What more is that polio infrastructure doing to help on this COVID response? So in Pakistan, they had established a call center for polio where parents could call to either report a possible case of polio or to notify officials that a vaccinator had not yet come to their house to vaccinate their child. The community mobilizers that I talked about are addressing not only protection against polio, but also how to protect against COVID with, messages on physical distancing, hygiene, overall health practices in Pakistan, Afghanistan, Nigeria, Cameroon, Angola, and others. In Sudan, the national medical officers are conducting training for the frontline healthcare workers. And then in Pakistan, the logistics officers that were responsible for the distribution of polio vaccine throughout the country are now working to distribute the personal protection equipment that's being made available. Here's another example of the plus in PolioPlus. In the polio affected and high-risk countries, Rotary has what we call national PolioPlus committees. And these are our focal points in countries that are working with government and our partners on polio eradication activities. So there was a wonderful photo of a vaccine carrier that had the End Polio Now logo on it, and it was being used by an official to, or a healthcare worker to transport COVID specimens from an isolation ward to a hospital to be tested. There was another just recent great photo of a small non-governmental organization in Pakistan with whom the local Rotarians partner for polio. It has become a testing site for COVID. So on the walls, you see all these polio posters, but they're actually doing testing for COVID. In Pakistan and Nigeria, the Rotarians have distributed food packages to needy families. In Pakistan, again, they've helped repair ventilators and distributed personal protection equipment. And it has the End Polio Now logo, like on the gowns and on the gloves. And some people, I think, are putting it actually on the masks. And then in India, Rotary founded what's called the Ulema Committee, which is a religious committee, religious leader committee. They're influential in communities to talk about the benefits of polio immunization. They are now being utilized to include messages about COVID and how to protect yourself against COVID. So when COVID was first coming on the scene around the end of January, the Polio Oversight Board, of which Rotary is a member, has representations from all of the 6 agencies that I talked about earlier, took a very difficult decision to pause polio immunization campaigns for a period of time so as not to contribute to the spread of COVID and to protect frontline healthcare workers. So the statement was that preventive campaigns and outbreak response campaigns should be paused at least until June to assess the situation at that time. The Polio Oversight Board will be coming out with another statement in a couple of weeks that starts talking about how do we safely restart polio immunization activities and actually other immunization activities, not just polio, even within the context of COVID, because we understand now that COVID's going to be with us for a while, and there's a need to protect children against vaccine preventable diseases. So even while the campaigns are paused for polio, for measles, and other things, surveillance activities for polio continue. So that laboratory network that I showed, while campaigns are paused, it's still working to pick up possible cases of polio so that when we do restart campaigns, we'll know exactly where there may be an outbreak. We're working to strengthen routine immunization in the areas that we are known to be at high risk for polio. We are ensuring the availability of vaccine and that it can be in the right place at the right time when we are ready to restart campaigns. And we're providing additional services to communities who have other health needs in addition to polio. And these are things like we're distributing soap in Afghanistan because we know that washing hands can protect both against COVID and against polio. And then we're going to do catch-up vaccination plans. There's a program of work underway right now where all the different streams of work are coming together to help us be in the best position when we are able to, again, safely start campaigns. And we've heard from our Rotarians in Mali, actually in Africa, that Mali as a country is sort of opening up from COVID and looks to begin to do some polio immunization activities in a particular geographic area already in June. So polio work continues. At the end of January, the World Health Organization declared COVID-19 a public health emergency of international concern. And I think what many people may not know that polio is the only other public health emergency of international concern. So we now have 2 globally. And this requires countries to, there's special reporting requirements if a disease has been determined to be a public health emergency of international concern. Rotary's advocacy with donor governments continues. In addition to Rotary and the Gates Foundation, donor governments such as Canada, Japan, the UK, Australia, Germany are major donors to polio eradication. And just yesterday, the Canadian government, was it on Tuesday, the Canadian government made a, that was Tuesday, it was yesterday, wasn't it? Made a commitment to global polio eradication, a 4-year major $100 million of funding for polio eradication. Rotary's fundraising efforts for polio eradication continue also unabated. We're working to reach our $50 million goal for this year. We're at about $35 million, so we have some work to do to fully leverage the 2-to-1 matching opportunity from the Gates Foundation. We're working hard to engage the media to tell the story about how the polio infrastructure that Rotary helped build is also working now to respond to COVID. And the Rotary's International PolioPlus Committee will be meeting via Zoom June 5th to consider all matters important to polio eradication. So this is my second to last slide. So the bottom line and call to action. I think first and foremost, every Rotary member can be proud that the polio infrastructure that we have built is helping support the COVID-19 pandemic. And it has done so in other instances. It helped with the earthquake in Pakistan. The polio infrastructure in Nigeria stopped Ebola in its track a couple of years ago. We've helped respond to yellow fever, SARS, avian flu. So as I said, we've got one of the largest kind of global health footprints in the world. You know, more and more, we're hearing stories about how the COVID-19 pandemic reminds people of the polio epidemics in the 1950s. There's been quite a few stories about that. You know, at the height of the polio epidemics, there was no vaccine. We have no vaccine for COVID right now. Polio targeted a very specific age group, you know, young children mostly. Now COVID, you know, is targeting an older age group, the same age group actually that experienced the polio epidemics. So there's a lot of reminders about the physical distancing for polio and how that's very similar to COVID. Rotary's dual priority. Of course, Rotary has to respond to COVID, and the Rotary Foundation trustees made $3 million available for disaster response funds for COVID. But we also have to remember that our global health focus is on polio eradication, and it is the #1 priority of the organization. Again, we talked about reaching the $50 million fundraising goal so that we can fully leverage the match from the Gates Foundation, and we need to begin immunizing children as soon as possible. That will require the full support of Rotarians everywhere. And of course, you can always feel free to contact me as a resource for information or any questions that you may have. So that concludes. This is a picture, one of my favorite photos. This child has been immunized against polio, and she's had her pinky painted purple, which is what vaccinators do so that you know if you're going out in the community to monitor polio vaccinations, you know that this child has been immunized. So that concludes my formal remarks, and I'd be happy to answer any questions that people may have, and I'll stop sharing my screen now.
So now is the time, if you haven't already put in your questions, either into the Q&A button or the chat box, and I'll pass them on to Carol. Carol, while we're waiting, maybe I could throw in a question to just get the discussion started, because I know people will have a lot of questions. You talked a little bit about this, or somewhat about it, but I want you just to expand a little bit on how the polio infrastructure is being used to fight COVID around the world.
Right. So for example, we know in Afghanistan, there's 3,600 community mobilizers. And these are folks that are in communities talking to families in between polio campaigns. These community mobilizers have now been educated on COVID. They have been given leaflets, in local language. They've been given protective gear to go out into communities. They have face masks. They've learned about physical distancing, and they are talking with families about how to protect the families from COVID, and they're distributing soaps. So they're having to manufacture locally soap in Afghanistan. Normally they would try to import some soap, but that is not possible because of logistics issues with importing goods. So they're locally manufacturing soap and giving out 2 bars to every family that is visited by these community-based health workers. So that's just one example. Another example is the surveillance medical officers that are looking for polio are investigating cases of COVID. So if somebody reports a possible case of COVID, they'll either do it by phone or by SMS, and then we'll give the family direction on where they can go get tested for COVID. So it's really the systems are very much the same for polio as they are for COVID. So the full apparatus of polio is really helping all over the world to support the COVID response.
That really is exciting. But Carol, the question that you want us to ask has been asked. Larry Gwynn asked, how can we contribute to the $50 million fund to leverage the Gates matching funds?
You can make a contribution online. You can go to endpolio.org, and I think there's a donate button there, or you can go to the Rotary International website, to Rotary Foundation, and contribute there. Thank you very much for the question. That's a great question. Because while we're fighting COVID, we're still working on polio. And so I just saw, and I'll see again tomorrow, I was reviewing a presentation on the surveillance system, sort of how is the surveillance system for polio still able to operate with COVID, with the, if you need to physical distance and whatever. So they're using a lot of telephone technology, Zoom meetings where it's possible to talk with families, to be able to investigate possible cases of polio, even in this time of physical distancing.
Carol, as a follow-up to that question, if people donate at endpolio.org, does Rotary track that donation back to the Rotarians' giving record to count toward things like the Paul Harris Society, Paul Harris Fellowship, etc.?
Yes.
That was a very short answer.
The short one, but it's a good one.
The next question is from past District Governor Sean Mitchell. He says, will RI be using any additional TRF funds to help with polio and COVID-19?
We hope to reach our fundraising goal of $50 million. So we probably won't need additional TRF funds for polio this year. And I think the trustees will make a decision whether or not to make more funds available for COVID. Trustee Jennifer Jones, some of you may have seen this, did a telethon, was it last Saturday, and raised over $500,000 for COVID, which allowed for an additional 21 disaster response grants to be funded. And Rotarians can contribute to the disaster response fund and have them allocated to COVID. So I think there's several different ways that additional funding for COVID may be available to Rotary members, but we do have more COVID applications than we have funding for. at the moment.
Thank you very much, Carol. At the moment, we don't have any other questions. Are there any more questions from our audience? Maybe
I'll
Cindy?
ask a question if I can.
Heinz, go ahead.
I'll bypass you there, Devin. Sorry.
Please.
What's being done on the worldwide scale right now that you might know about in trying to find any type of vaccine for the COVID? As we obviously we have a vaccine for polio, so that's what everybody's looking for. Do you know anything about what's being done?
Well, I think there's many initiatives underway for a COVID vaccine. I mean, one that I'm most familiar with is, I think he's an honorary Rotarian, Dr. Peter Hotez. He is from the Houston area, and we were just talking with Peter the other day. He is working on making a low-cost COVID vaccine that would be made available, that you could reproduce and manufacture in the developing world. Like you could manufacture it in India, you could manufacture it in Brazil. So making it a formula that would be accessible to everyone so that it would be equitably distributed throughout the world. So I think, we're hearing different timelines on the vaccine. Vaccines take a long time to produce. I think the oral or the inactivated polio vaccine back in the 1950s took 8 years to produce and to go through the clinical trials, et cetera. So for COVID, they're talking about a really accelerated timeline of like 12 to 18 months to 2 years. So I think there's lots of activity on the vaccine side, but also some activity on, are there other therapeutics or drugs that could be used to alleviate some of the more severe symptoms of COVID? And one of the ideas out there by the guy that developed the HIV vaccine is whether or not something like the oral polio vaccine could provide some level of temporary protection, very temporary protection against some of the more extreme symptoms in COVID patients. So a lot of research going on, but no silver bullets quite yet.
Okay, we've got some great questions. Elizabeth Parker says, thank you, from a fellow Evanstonian.
Oh.
So, and then Governor Sean asks another question. He says, can and how can Rotarians donate directly to the COVID-19 pandemic through Rotary International?
I think you go to the Rotary website and I can get more information on this, but it's through the Rotary website. You can make an online contribution to the COVID, to the Disaster Response Fund, and it can be earmarked for COVID. So I'd say the Rotary website is the right place for that. And I'd be happy to send a link to whomever after this call or tomorrow, and you can get that out to the folks who like to know.
Thank you. And Chris Swanson asks, how much of a setback will COVID be on polio immunizations, and are we already seeing an impact to numbers of infections?
Yeah, that's a great question. And it's hard to say. Certainly there will be an impact, because if you're not able to do campaigns, and you know that you've got wild polio virus circulating in Pakistan and Afghanistan, the longer you are not immunizing children, the more vulnerable they become to polio. So we anticipate there will be an increase in cases as we move forward. I think there's several elements to that question too, is how quickly are we going to be able to figure out a way to safely undertake polio campaign-like activities safely within the context of COVID. And we'll probably able to do that maybe in certain geographic areas of a country that are not having major COVID outbreaks. Maybe you won't be doing national campaigns, but you'll be doing, as I said, smaller geographic campaigns. And then of course we utilize modeling, mathematical modeling, to see what the world might look like in a month or 2 months or 3 months. We've only detected 54 cases so far this year. We know that there are some specimens that are not being able, we can't ship them because you can't get them out of a country because of there's no flights going out to get to a lab if a country doesn't have a lab. So, I mean, that's one of the great unknowns, is exactly what will the world look like when we are able to start getting campaigns underway. But no doubt it's a setback, not only for polio, but for all of the like disease elimination programs like measles, yellow fever, et cetera, where you're just unable to conduct campaigns at this time.
Another question. Thank you very much for answering Chris's question. Jim Leray asks, Native Americans have been hit hard by COVID-19. Do you have any grants projects to help these groups on the reservation?
That's a good question. I am less familiar with our disaster response grants for COVID and where they are in the world. So that's a good follow-up question for me.
Okay, that's the end of the questions we have served up. I don't know, Cindy, Marilyn, Sue, Hines, do you have any questions for Carol?
I have one more.
I'll go when you
hear so much about flattening the curve. Do you see any bright lights in the future? I mean, how are we doing? You hear so much contradictory comments. Everything has become political, so it's hard to find out what is really going on. So what do you think?
Well, I know we're,
in other words.
I think we're making progress in some places, and I think we're not making progress in other places. I mean, we're not making much progress in Chicago. We are not flattening the curve very, to be honest, in Chicago for whatever reason. I think you've seen a flattening of the curve in Germany because they were very strict about their physical distancing, and people adhered to that. So I think it's kind of spotty all over the world. So I think some places are making progress and other places have yet to experience maybe the major outbreaks that other places have experienced. So I don't think we're quite over the hump yet.
Well, that's a concern that's been, here in Utah, we've gone from code red to code orange, which I think is the next step down to start opening some businesses up and allowing some limited access to previously closed businesses. But what that really means, I think people are still questioning what do we do? Is it safe to go out? So that's an issue that's been discussed a lot.
So,
Yeah.
Oh, go ahead.
No.
So because Rotary International has been involved in this eradication of polio for so many years, do you think in the future, plus they've been involved in other outbreaks throughout the world, do you think once we have a vaccine that we'll be doing polio and COVID-19 vaccines?
That's a great question. And it depends on what kind of vaccine it is. So because through the Global Polio Eradication Initiative, we're using an oral polio vaccine, which is like 2 drops right into a kid's mouth. And everyone can do that with a little bit of training. There's also an injectable vaccine, polio vaccine. And measles is an injectable vaccine. And so if you're using an injectable vaccine, you have to have a more highly trained workforce to do that. So it depends on what kind of vaccine the COVID vaccine turns out to be, or if there are 2 formulations, as there is for polio. Maybe there is an oral formula that can be distributed by volunteers, and then then you could see the infrastructure easily, being utilized. So I think some of that remains to be seen. What I do think you'll see is the polio infrastructure continuing to provide education on COVID. If it's an injectable vaccine, there's still opportunities to provide information about the safety of the vaccine and why you should have your children and families. I'm sure adults will be immunized as well, why it's important to do that. If I could just encourage one thing. So at our, at the virtual convention, which I'm sure many people have heard about, starting on June 20th, during the opening general session, there's going to be a session on kind of global health. And one of the participants is from the World Health Organization, and he is one of the leaders on the COVID response for the World Health Organization, who spent some time and was part of the first group of international scientists that were allowed into China. And he will be speaking on a panel, as will a representative from the Bill and Melinda Gates Foundation and from the U.S. Centers for Disease Control and Prevention. Well, now they'll be talking about polio, but they're going to be talking more broadly about global health and particularly COVID. So I would encourage everyone to tune in for that virtual session on the 20th of June. I think folks are going to find that really interesting to hear from that level of expert on both COVID and polio.
Can I say something, Devin?
Yes.
Okay.
You don't need my permission.
Oh, I didn't know if you had someone else in front of me that wanted to speak. I just wanted to take the opportunity to say to all of the club presidents, foundation chairs, club members, foundation specialists, anyone, involved in this Zoom meeting tonight, so that we can maximize the incredible gift that's been given to Rotary by the Bill and Melinda Gates Foundation to help fight polio, that as we wind down our Rotary year, that we really encourage our members to make those contributions to the PolioPlus portion of, Rotary, so that we can not let this fall too far behind, with what's happening with COVID-19. So anyway, thank you, Carol, for bringing that up and letting us know how much more we need to accomplish to make that goal.
Thank you. Thank you very much, Sue, for that comment. We've just extended our relationship with the Gates Foundation for that was announced at the International Assembly in January, which seems so very long ago, actually. And we were living in a totally different world at that time, it seems. But we've extended it for another 3 years. And so we are in a strong, strong relationship with the Gates Foundation.
Thank you.
All right, any other questions? So thank you, Carol. We really appreciate you taking time out to talk to our club here and the guests that we have. Thank you, Devin, for making it run smoothly.
An honor, thank you.
Thanks, everyone. I hope you all stay safe and healthy and have a wonderful rest of the week. And unless anyone has anything else, we'll go ahead and end this meeting. Hearing nothing. Oh, we're done. The bell has rung.
Thank you, Carol.
Thank you, Carol.
Thanks, everyone.
Thanks, Carol.
Appreciate
Great
the
to see you.
opportunity. Thanks.
Bye-bye.
Good to see you all.
Bye-bye.